One common question that I get asked is, how do I know if I need spine surgery? Knowing when you need spine surgery is difficult, and it often takes meeting with a physician to help translate the symptoms you're feeling, such as back, leg, or neck pain, to the need for surgery. In general, if you're experiencing back or neck pain that is keeping you from living your life or functioning normally, it's really worth going to your primary physician to understand if you need imaging studies, for example, an X-ray or an MRI, to help better diagnose that. If the imaging shows that there is an underlying structural problem with the spine, then that's a perfect time to go seek the help of a spine surgeon. Another question I get asked is, why is my spine surgery not working? Sometimes spinal surgery can change the mechanics and posture of the spine, and it's really hard to predict how the body will react to those changes. If a second spinal surgery is needed, it is often useful to seek the help of a spinal surgeon with specialty training in scoliosis and deformity surgery, because it is very important to consider the overall shape of the spine in those cases. Most commonly, the spine can tend to bend forward after spinal surgery. That leads to difficulties standing up straight. Here at OU Health, we specialize in surgery to address that problem, which is generally called adult spinal deformity surgery and specifically loss of sagittal balance. Decades of research has given us the specialty tools and training to address sagittal imbalance, which is a great reason to seek a referral to OU Health. Another common issue is how to walk and walking. In other words, why is it important to study how we walk in relation to spinal surgery? One active area of research at OU Health is the study of gait, or how we walk. From the most basic standpoint, the spine is biomechanically positioned to allow us to walk on 2 feet. In fact, most spinal problems lead to a reduction in the ability to walk normally. However, there is no objective way currently to measure gait that is reliably used in the clinical setting. At OU Health, we are combining the latest technology and research to address that. Specifically, we have patients walk on what we call a gait machine, which is like a long carpet with thousands of pressure sensors that measure footfalls with incredible precision. This allows us to very accurately obtain detailed information about each patient's gait and how the spine affects how they walk. This technology will not only help us monitor patients before and after spinal surgery, but can also, in the future, help us predict which patients will do well with surgery. Ultimately, this technology is another great example of how we are focusing our academic, clinical, and research missions to the care of spinal patients at OU Health. It is certainly an exciting time to be involved in spinal surgery and to be a part of the spine team here at OU Health.